Hey there, this is Ari. Welcome back to the show. Before we get into today's episode, I want to let you know about something I am incredibly excited about, which is Ultra Brain. Ultra Brain is our premium brain health support formula. And it is, well, let me put it this way. Um, Most people over the years spend thousands of dollars on supplements. I myself have spent, geez, since I was a kid, probably I hate to admit how much money, probably many tens of thousands of dollars on supplements. And if you're anything like me, you probably have realized that the vast majority of all of that money spent and all those supplements you bought, you probably didn't notice any real effect from the vast majority of them. And I got sick of this and I decided to do things differently. I decided that I wanted to create supplements that I don't care about my costs to build those supplements. All I care about is I want supplements that actually work, that actually give people real noticeable results in their life when they take them. And all of the supplements, I have 4 supplements that I've created now. All of my supplements are built with that in mind. They are, to give you a little insider's look into the supplement formulating industry, my costs for formulating these supplements are typically 5 to 10 times higher than pretty much all other supplement formulators. And all my friends who are in that industry all tell me that I'm absolutely nuts for what I'm doing. But the reason why is because I'm using not only premium ingredients, but I'm using real dosages of these ingredients. And that's the thing that most people don't understand, is that most supplement companies are cutting corners where they might use quality ingredients, but they're putting them typically in 1/5, 1/10, or 1/20th of the actual real effective dose that's been shown in scientific research to provide a benefit. So the net effect of that is people end up spending money for a supplement that is just not giving real dosages and therefore not providing any noticeable benefit. So like I said, I do things differently. I'm putting in real doses of these ingredients. And my goal is to actually provide you with amazing life-changing benefits. So with all of that said, I have to say that Ultra Brain in particular has been the supplement I've been most blown away with by the feedback. I would say literally almost everybody who takes it reports a very noticeable effect from taking it. And I've been blown away by the amount of people that have just described it as life-changing. I had one woman just a couple of days ago in our private Energy Blueprint program Facebook group say that she thinks that it's literally cured her CFS symptoms that she's had for many, many years now. And she's absolutely just astounded by it. So I'm getting that kind of feedback on a level that I have to say has even surprised me, because it's just so common for people to report that kind of life-changing feedback. But Ultra Brain is absolutely, just bar none, the most powerful mood optimization brain health support formula on the market. And it really provides incredible benefits for focus and mood optimization, combating depression and anxiety in particular. Just to give you a glimpse of why that is, there's a couple of ingredients that even just as individual ingredients have shown themselves to be on par with the effects of antidepressants, anti-anxiety drugs, and things like that. For example, saffron extract. There's research on that compared to Prozac showing that it provides basically equivalent effects, antidepressant effects, in the context of people with depression to fluoxetine, which is Prozac. Same for acetyl L-carnitine, amazing antidepressant effects. There's other ingredients in this formula, for example, rhodiola rosea and lion's mane, which have shown powerful not only antidepressant effects and anti-anxiety effects, but also, and especially for rhodiola rosea, the ability to help people with chronic fatigue or with chronic burnout to massively increase their energy levels literally within a few weeks. So that's just to give you a glimpse of, I think, what did I name? 4 of the 15 or 18 different ingredients in Ultra Brain. We've put together a page for you outlining all the science on these different ingredients. Go check it out. You can find it at store.theenergyblueprint.com. and go try out this formula. If you struggle with depression, if you struggle with anxiety, if you're looking to increase your energy levels, if you're looking to optimize your brain function, your mood, your energy levels, as well as your long-term brain health, and actually reduce your risk of dementia and cognitive decline, this is an incredibly powerful formula. And I strongly encourage you to go grab yourself some and try it out. I think you're going to be blown away by the results. So go to store.theenergyblueprint.com. Hey there, this is Ari. Welcome back to the Energy Blueprint podcast. I am super excited to welcome back for the second time my friend, Dr. Rajka Galbraith. And this is going to be kind of a part 2 episode following up on the previous podcast, which covered basically everything you need to know. Well, not everything, I guess, since we're doing a part 2, but a lot of what you need to know to as far as the optimal tests to get done from a functional medicine perspective for people dealing with low energy levels or chronic fatigue. So a little bit of her background, if you didn't hear it already in the first episode. Dr. Rajka has been successfully leading women and their families to optimal health for over 2 decades as a board-certified family medicine doctor. From delivering babies to managing family care in the clinic and hospital, she's now exclusively a leading functional medicine consultant certified by the Institute for Functional Medicine, an international speaker and mentor to practitioners, having trained hundreds of practitioners and an expert in environmentally acquired illnesses. As a woman and an entrepreneur, she's passionate about empowering other women leaders to optimal health and performance. Her ultimate goal is to empower women to optimal health and in turn have them empower their families and their tribes to optimal health. She has expertise in resolving brain fog and environmentally acquired illnesses, as well as nutrigenetics. Recently, she launched the Conquering Mold community to provide a cost-effective means for people to heal from mycotoxin illness. And soon, she will launch the Radiantly She community to recover women from fatigue, brain fog, and weight gain. She also sees patients at the clinic she founded, Simply Health Institute, outside of Chicago. And I also want to mention it on a personal note, a little over a year ago, I found mold in my own house and I was experiencing some symptoms, and we discovered basically a huge mold infestation in the walk-in closet that was about 10 feet away from my bed. And that mold was probably growing for several months before we found it, because it was actually hidden behind all this clothes and all this stuff that we had stacked in there. So after we found that, I reached out to Dr. Galbraith, and she helped get me set up with testing, urinary mycotoxin testing, which is something we're going to talk about in this episode, which subsequently uncovered pretty severe mold poisoning, especially with mycophenolic acid, which was off the charts, which is a very potent immunosuppressant compound, which, by the way, not an ideal time to have a very potent immunosuppressant compound in your body when COVID is around. So anyway, I have subsequently, for the last year or so, been following the guidance of Dr. Galbraith as far as detoxifying from mold mycotoxins. So she's literally the person that I myself sought out to help me deal with mycotoxin illness. And she's been absolutely wonderful to work with. And for anybody in that situation, I highly recommend doing the same. So with all of that long intro out of the way, Dr. Galbraith, such a pleasure to have you back.
Thank you, Ari. It's so great to be here. And I think with our first episode, we got lots of great feedback, people just wanting more. Well, what do I do next? And, our goal for both of us is really to educate as many people as we can so we can prevent needless suffering. And always a pleasure to help out my fellow compadre in the field. And I'm glad you're doing even better, because I know at the time you were doing pretty well, but on your own accord. But yeah, I'm grateful to be back.
Yeah. Thank you so much. So for people who didn't hear part 1, tell us a little bit of maybe the succinct version of your personal journey and why you're doing what you're doing.
Yeah. So, it was really several decades of fatigue, and each layer of learning got me to overcome all these symptoms and illnesses I had. And it was really disheartening initially to not almost be able to achieve the three goals I had, the dream of being a doctor, the dream of getting married, the dream of having children. And, it went from so much fatigue that I almost didn't finish residency to, I was so profoundly fatigued. I think we joked last time, falling asleep on dates. And then, the ultimate slap in the face was, them being told, you've got unexplained infertility, and, very, very sad. And so it took me lots of years, so 8 years, and almost another cost of a medical school education to recover my health. And it's been in very distinct steps, because each decade it seemed like I'd recover myself and I feel pretty good, and then something else would happen and be like, okay, well, what's this? And then I'd learn and studied some more, and it wasn't really till I had a deep dive to know that now I can keep myself well with all the things I'm doing and just gentle support, so I don't ever go back and regress. And in fact, I feel more amazing now than I ever did in my 20s, and I'm 52 and a half. So so I feel great.
Beautiful. So do you want to jump into kind of following up on the previous episode? I want to cover mycotoxins in this episode and protocols around that, or like how to deal with that and how to test for it. But do you want to jump straight into that, or do you want to go into kind of a follow-up on testing for fatigue first?
Just a brief follow-up. So one of the things, and then it'll segue right into mycotoxin illness, because when you see the results on the organic acid testing, it can signify that fungus is there, or even yeast overgrowth. And I've kind of changed how I've done things. So it depends on what people are looking for, how well they feel, but a top tier test, including blood work, would be organic acid. So I've started, the pendulum will always swing. So we order a lot, and then you say, okay, what can I not do with? And now I'm back to ordering organic acid tests on almost everyone that comes through the doors, if not at the first visit, but the second visit. There's just so much to address. And for those that don't know, an organic acid test is run just with a urine sample collected first thing in the morning. And it looks for 5 different areas. One is looking at bacterial overgrowth, yeast or fungal overgrowth in our GI tracts. It looks at our neurotransmitter status, which some people poo-poo, but I've seen great clinical validity, nutrient status, as well as how does someone detoxify. So you've got 5 separate areas with one test that you've hit, and it's a plethora of information. And the biggest of that area is, what is going on with the fungal colonization or yeast colonization of someone's gastrointestinal tract. And so if I'm seeing that on an OAT test and someone has not reported being exposed to water damage building, right away I'm thinking, okay, we have to do the follow-up test. So then we can dive in. And the follow-up test to really solidify, is there mycotoxin illness or not? So certainly if someone is asymptomatic and they've got mold exposure, then they're probably in that 70% that don't have an issue. And remember, about 30% of up to 30% of the population has a problem and is susceptible to mold. And you can test that with HLA typing. It's not necessary to do. Typically, if someone comes into me sick or unwell, then they're susceptible, especially if we find mold. And mycotox testing, top 2 companies that are running the testing is Great Plains Lab and Real Time Lab. Same thing, urine test. I do prefer it being provoked, and that means that we're giving an agent to try to draw it out of the body. In most instances, I'm doing glutathione, which some people don't tolerate. So if they don't tolerate, then we have them do some sort of sweating or sauna the night before. We provoke for about 5 days, and then you collect the urine. And it's looking for distinct toxins that are being spilled in the urine. And as you said, mycophenolic. And so ochratoxin, mycophenolic, and citrinin are all kind of byproducts of ochra toxin. And then it looks at aflatoxin, zearalenone, and so on and so forth. So there's a whole long list of them that we find. So if you find it present and someone has symptoms, so I'm not certain, you can't say the relevance. If someone comes in well, you're not going to go chasing after that. So there are certain people that aren't susceptible that will never affect their health. But for those of us, it does. And I have that mold susceptibility. So it's a big deal if I'm exposed. And we're not talking one time, you're exposed to mold. And it's typically not the mold you see that you smell, but it's the hidden mold. That's a bigger problem that people don't even know. Like you said, you didn't even know, right? Yeah. Yeah. How was it to collect the urine and do the testing? Not a big deal, right, Ari? Some people think it's a big deal.
It was super easy. I mean, blood tests are a bit intimidating. I mean, you have a little bit more resistance that comes up because you got to drive to a lab and you got to get needles stuck in your arm, and some people are just uncomfortable with that process, and I'm uncomfortable with that process. I mean, I don't freak out or anything, I don't panic, but
Yeah.
I generally don't like needles poked into my body, and I don't like blood drawn out of my body. And then also, the last time I did a comprehensive blood panel, it was a very comprehensive blood panel with so many different tests that they had to take many, many vials of blood. And I remember distinctly for about at least 2 days, if not 3 or 4 days afterwards, I could really feel the lack of blood when I was doing exercise. Like it felt like exercising in elevation, because it had dropped my red blood cell count significantly enough that my performance was impaired. So all of that creates quite a bit of resistance. In contrast, the urinary mycotoxin test, it's like first thing in the morning, you wake up, you just grab the little plastic vial, you pee in the cup. It's not a big deal at all. And then you stick it in the freezer and mail it in. And so, yeah, that process is super easy.
And that's why I love it too, as a starting point, that organic acid test for kids in particular, because I can't tell you how many kids are not going to be going in for blood draws. And so I can get a really pretty good overall picture as to what's going on. And then the mycotox test just kind of segues. And, that might be another question the listeners may want to know, like, who would you draw? Who would you do a mycotox test on, right?
Mm-hmm.
And so I think about doing a mycotox test on anyone who is just not responding to treatment. And so if I see someone and we do just blood testing, typically with the usual protocol, even if I don't know the results of the blood testing, by getting clear on their history, we get a minimum of 50% improvement if someone does some of what I've recommended. So not even all. And so I don't want to tell people to just do some. We want you doing as much as you can, but 50% improvement, that's huge. But if I see someone who's putting in a little bit of an effort and they get no improvement, or they're plodding along and they're really not getting better, or they're super sensitive, then I'm thinking something else is going on. And clearly, if I get the history that, oh yeah, I grew up in a home and it flooded every summer or every spring when the rains were high, then I know. But sometimes people don't know. And you have to think about, it's not only your home, but it's your work environment. So, and your cars can get moldy. And so if you're unless you're in one environment, you may not be able to identify a source, and it could be an old or current exposure. So we're looking at people who have the 3 common symptoms, which are brain fog, fatigue, or pain, or even new onset anxiety or depression or panic. So the big major symptoms, not responding to the protocols like we normally would expect. And so my early protocols are really simple: diet and lifestyle, a handful of very targeted supplements. And we're talking 2 to 3 to 4 to 5. I mean, no more than 5. You don't want to overwhelm someone. And almost always the ones I kind of pinpoint at that first visit are what we're continuing. I always identify that this is what they need on lab testing. So it just helps me confirm. In fact, I may even beef it up a little more. And then, or we have the history of the water damage building exposure. So those are the things I'm looking for to go to that next level of mycotox testing.
Okay, so just to clarify that, so it sounds like there's 2 contexts where someone would want to do mycotoxin testing. One is my context, where it's like, okay, I've discovered that there's mold growing in the wall of my house, and I know that I've been exposed to this for at least weeks, if not months. Mm-hmm. And I need to figure out, if my body is toxic from this mold exposure that I know I just had. And then the other context is, I may not know about any mold exposure in my life at all, but I may just have weird, unexplainable symptoms, and a lot of the things that would normally make people better are not making me better. And so now it's time to figure out, hey, is mold mycotoxin exposure at some point in my past, whether I know or not, is that a factor in my symptoms? Is that accurate?
That is accurate. So those two contexts are super huge. And I'd say clearly if you come in, the other one is if you come in, remember I said the top symptoms of brain fog. If you come in with already a diagnosis of dementia, we know that it's the third subtype of Alzheimer's disease. That was described by Dr. Dale Bredesen. So then we get that testing right away just to make sure, right? Because you don't want to wait. You don't want to wait even another month or two to try to remediate that.
Gotcha. So, and the tests that you do to identify mold mycotoxin, you mentioned organic acids tests as a sort of preliminary test to maybe give you a clue, and then you use urinary mycotoxin tests from Great Plains laboratories or real-time laboratories or to see which specific mycotoxins a person is toxic in. Is that accurate?
That's accurate. And because the treatment all depends on which mycotoxins are present, and which goes hand in hand with when do you know someone's cleared? And it's really a clearance of the mycotoxin testing, mycotoxins out of the urine. And so other practitioners have other protocols, but that makes the most sense to me. And that's where I'm seeing the greatest resolution of symptoms. And then we know we've got our endpoint so you can stop treatment.
Okay. And so what does that look like for people? I mean, I could talk about my own personal experience, but I'm just talking about one sliver. And I think I also did kind of a partial protocol. I don't know that I did the full all-out protocol because I didn't have severe symptoms. You kind of gave me the okay to do a more like gentle protocol, I guess you could say. But give people a sense of maybe what, if you're toxic in this mycotoxin versus that one, how might the protocols sort of start to look?
So I'm going to talk about the 4 reasons why people don't get better and the 4 steps. So the first step really is to prime the body. And this is why people don't get better sometimes. And they've seen them, a handful of practitioners. And by priming the body is that when our bodies, and you would know this because you love the mitochondria like I do, when you're exposed to a threat, the mitochondria go into survival mode and they shut down. And that's a normal response. The problem is in some people that mitochondria gets stuck. And we call that the cell danger response. And even if the threat's been removed, say that the mold exposure was when they were a young kid and they're home growing up and it's no longer there, the only way they know is to respond with the threat. So anything I give them to take to bind, to detoxify makes them worse, or it doesn't work. Usually it makes them worse. And so that's not a good place to be, or they're super sensitive to anything. And we talk about 2 modalities to get them out. You really want to do vagal nerve retraining. And so the vagus nerve, is the communication from gut to brain. It actually regulates our heartbeat. So if you hold your breath, you're going to stimulate the vagus nerve and you're going to slow the heart rate down. And so I teach patients a wide variety of modalities. Every patient that comes through my office gets taught heart math, and I send them out with a sensor because it's a tangible result. We have good data behind it. And we know that with just utilizing that, you can improve someone's depression by 48%. No drug can do that. And that's in 6 to 9 weeks, using it maybe 10 to 20 minutes a day. Huge, right? And then I'll use another modality. So we want to vagal nerve retraining. Say someone can't afford a sensor. You can do humming, singing, gargling. These are all things to regulate the vagus nerve. And you can actually, maybe a partner will have to do it. But if you have someone look in your mouth and you say, ah, and the palate doesn't elevate very much, or you don't have a very good gag reflex, that's pretty much a tip off that the vagus nerve is not being triggered as it should be. And a lot of that happens not even from just mold, just from being chronically stressed. So that'll suppress that. Super huge vagal nerve retraining.
Real quick, and sorry to digress, but just what is the link between mycotoxins and the vagus nerve? How are they linked physiologically?
Physiologically, it's just a stressor, and mycotoxin illness does cause a component of adrenal dysfunction too, as well. And so then it's just a way out of it, I guess. So I don't know. It's kind of a byproduct more than a direct insult. So it's really just that someone's gotten into the threat, or the mycotoxin exposure is a threat to the body. And in some people, it just triggers a cell danger response. So it's just to help them get out of not only adrenal dysfunction and have more energy, but then allow them to respond to the usual therapies.
Got it.
And so the vagus nerve controls, parasympathetic. And then you got the limbic nervous system, which is, your drive, your sympathetic. And so that gets dysregulated, and that's an even bigger challenge. So that's really what I think is a driving force. So I use two different modalities I'll recommend patients really review. One is called Dynamic Neural Retraining System, DNRS. And the other one is the Gupta program. DNRS uses positive affirmations. It's an online training program, a couple $100, I think $250 online. And Gupta's program is more meditative and also serves the same purpose. And so I was just reading or listening to the book, The Art of Impossible. And the gentleman who wrote it was sick with Lyme disease and couldn't get out of bed. After 3 years of antibiotics, just couldn't get out of bed. And one day he was contemplating suicide. And I hear this a lot, and it makes me sad when someone comes in and they're thinking, I have to end my life because I just feel that unwell. And a friend took him surfing, and he got into the moment and then was a wreck for 2 weeks. And he decided to keep doing it in over 8 months. So he used it as a meditative time. So that was his way of getting into that. So in my personal humble opinion, I think he had cell danger response. And that's why he wasn't healing with antibiotics and all the usual treatment. And he got himself about 80 to 90% better over a course of 8 months. So each time he went back, his recovery got better and better and better. So that's the testament of how powerful this is. And what I've seen clinically is anywhere from 50 to 90% improvement using one or the other modality. Excellent. So prime the body. That's the first step. Mm-hmm. And by priming the body, it's also the usual things we do: eat right, sleep right, hydrate, make sure you're having good bowel movements. If you're toxic, 2 a day. If you're well, then at least 1 a day. And then once that's primed, then we go in. The first step is you want to treat it in the right order. And what do I mean by that? Typically mold trumps all the other things out there. Trumps Lyme, it trumps heavy metals. And in fact, what I've seen come through the doors is if someone's chelated for heavy metals or treated for Lyme, they tank or they do worse. And that's a tip off that, hey, maybe there's mold going on if they do worse. And so the first step in the right order is binding the mycotoxins found. And that's why testing is so important, right? So you have ochratoxin is bound, there's preferential binders. And so typically we think of things like charcoal or cholestyramine, which is a prescription medication, ironically, to lower triglycerides in the body. So it's a binder. And then Welchol, same thing, utilized for abnormal lipid profiles. So you want to identify the toxins and treat. And we start low and go slow. It's not a race to the finish. In fact, we can make you worse if we throw all the binders on at one time. And so it's a gradual incremental thing. And people say, well, how often should I increase? I'm like, well, every 3 to 7 days, you're going to up the dose. Really sensitive people say we're going to go utilize activated charcoal as a first step. Is that maybe you'll do, if you tend to react to everything, maybe you're doing half capsule. Maybe you're doing, 3/4 of a capsule, and then you'll gradually increase. And so some people, you don't necessarily even need to be on the full doses, but small doses of all the appropriate binders can work synergistically. So treat in the right order. So that's super important. And then the third step to this is then you want to treat the GI colonization if you see it. So the OAT test will tell me, is it yeast or is it fungal or is it both? And you'll go in after with the appropriate either antifungal medication. So there's prescription ones or there's herbal ones. If there's mold overgrowth, typically the prescription ones do work a little bit better. And these guys are sneaky. So they oftentimes will create a biofilm. And so we give agents to break down the biofilm while we're treating the gut.
So this is, as far as I can tell, and I've tried to look into this quite a bit, given my own personal interest in mycotoxins, given that I had mycotoxin poisoning. I've been kind of fascinated with the concept of mold colonization. And these things often seem to get conflated by a lot of practitioners. And I think I'm under the impression that it's somewhat controversial. Like there's a different take within the functional medicine community as compared to the conventional medical community. But maybe you can help me dissect these. But my understanding, or what was intuitive for me, was if you have mold growing in your house and you're exposed to that, you're getting, let's say, exposed to mycotoxins, you're getting exposed to, I guess, mold spores that are in the air. And more than likely, your body will sort of process those in a way that, your metabolizing and detoxifying those compounds. But then there's this other issue, which is mold colonization, that those mold spores can get into your system. They can get into, let's say, your respiratory cavities or your gut, and then colonize, and then be producing mycotoxins from inside of your body. And so there's an issue, I guess, whether a mold detoxification protocol entails just binders to bind the mycotoxins from the exposure from your home, and all that really needs to be done is remediation of the home, let's say, knocking down the wall and repairing it and getting rid of the mold, or whether you also need to take, anti-mold compounds, antifungal compounds that help kill the stuff that's in your body. Just help me and everybody else discern and differentiate between those two issues.
So that's the $1 million question. I love that you asked that. And as a practitioner, my protocols are always evolving. I'd say the sicker you are, so someone who comes in with dementia, I would take it a little more seriously and say, hey, likely we need to also treat the GI colonization, because if you don't and you get rid of the mold, that the mold overgrowth in the gut will just make it all come back once you start the binders. Now, and I wish there were a way to test this, to say, okay, how about those that come in and it's more of a new exposure? Like they didn't have an exposure as a kid and they found they had, one gentleman that saw me recently, he was in a hotel room for 5 days. And that's what the straw that broke the camel's back. So clearly he had some imbalances and he was just thrown under the bus for a year. So he got out of the environment after 5 days. So presumptively, so he never tested the home. They actually moved fairly shortly after, and he was kind of alert to it. And this new home is tested safe. So we don't know his other exposure, but I would say probably the longer you're in it, really important to treat. In general, most of us are treating, but I like to listen to the patient as well and say, hey, because you're right. Anytime you tamper with the microbiome, you're going to be adjusting it and you're going to have the repercussions. So think about, for a perfect example is people who have insulin resistance. So they're pre-diabetic or early diabetic. Sometimes we'll use berberine, which is an herbal, but I caution against using that for too long. So I might help them lose weight and get them out of that. But you don't want to be on anything long-term. So I got to always weigh the risks and balances. And so that becomes almost a case-to-case basis. And maybe we'll do a follow-up once more studies are done. So, one of the studies they did do, if it hasn't been published, it will be, and Dr. Neil Nathan ran, was they actually fed people moldy foods to see, can moldy foods increase these mycotoxin excretion? In the urine, they found they didn't. So this is truly from water damaged buildings. So we know that, but I wish there were more of a quantifiable. So right now we're treating based on protocols that were set by those before us and what we're seeing and whether we're seeing clearance or not. And
it sounds like the whole mold, and mycotoxin in coffee issue is probably overblown, given that.
Yeah, probably overblown. So, but I would say the only time maybe wouldn't be is you can have mycotoxin illness and mold allergy all in one. And then that would be probably more of an issue, or someone who's just super sensitive. So it'll just make them sick, and it's a different reaction, completely different reaction.
Okay. So I have some practitioner friends of mine who, when I've talked to them about the issue of colonization upon mold exposure, their way of framing it is more, what is the health context of the person who was exposed? Are they a young person in relatively good health? And therefore, do they have a strong microbiome that can likely resist colonization from, some kind of opportunistic mold exposure? Or are they someone who's, let's say, elderly in poor health status already? And if so, the colonization aspect of things is much, much more likely to happen in the person in poor health or old age. Do you agree with that framing or not?
I do agree with it. I am currently treating everyone, but the interesting thing is, in reflecting on the demographic, most of my patients who are seeking treatment right now are, 50 plus, starting to get 40 to 50. And I think, I have a few children I'm treating. So I think I would tread differently in those instances. And, really the true test will be to say, hey, if you get clearance, is to retest 3 months, 6 months down the road and make sure it's sustained as long as they're out of the environment. So yeah, super important. I agree. You should probably look at it differently. They're going to have different.
So a little personal anecdote. When I was very young, when I was a teenager, I struggled with acne. And I had read a book at that time written by, someone who not any sort of expert or something like that, but someone who was saying, hey, I've got the acne solution. And he wrote a book, an ebook that I bought as a teenager that had all these methods to help fix the acne. And one, aspect of it is like, everybody's got parasites. And so you have to kill the parasites, and everybody's got candida. And so you've got to kill the candida. And I remember at that time trying all this stuff and taking all these antiparasitic stuffs, black walnut and wormwood and taking all these antifungal stuff that was supposed to kill the candida that was causing my acne. And anyway, my point is to say that I actually had a long history of trying like lots of intense antifungal and antiparasitic compounds, and I can't say that I ever noticed any benefit from doing so. And as I've got, in the 20 years since then, as I've been studying health since then, I've gotten, obviously there's been a huge explosion of knowledge around the microbiome since then, and an understanding also of how, for example, antibiotics can screw up one's microbiome. So I've become, I would say, I err on the side of not tampering in the context of someone like myself who's already in good health, or, for example, my son who was in the bedroom with us, also exposed to that mold and had symptoms from that mold exposure. He had sinus issues, congestion, and runny nose frequently for a few months during that mold exposure time. And my inclination with both him and myself was to not do any sort of intense antifungal protocol to treat colonization or suspected colonization, or any sort of nose rinsing or anything like that, because I didn't want to screw up what was already a very healthy microbiome in my case, in his case. And I know we had discussions around that, and we had a bit of a back and forth, and you were okay with me doing that. But I just want listeners to kind of hear what your take is on my thought process and my decision-making process.
Yeah. So here's what I've always known, even before I knew functional medicine, that you got to listen to the patient and their instinct. Sometimes even before I knew functional medicine, I would say, what do you think is going on? And sometimes they really, honest to goodness, wouldn't know, but sometimes they would. Or say when it came to a child, you're really worried. I can see that. I've kind of reassured you. What is your fear around this? And sometimes it would be unwarranted. It's because they were rightfully so being mama bear or papa bear, but sometimes as they really knew that there was something else underlying. And so we'd go explore it. So I've always had that collaborative relationship. And that's part of what I think makes myself and many of us in the field good practitioners, is that you have to also, you use your medical knowledge, you use the history, you use the labs, but then you also have to combine it and you add in that, the instinct, and your gut instinct is probably right. And it's funny that you said, hey, I did all these things they said would help. I wonder, what do you think was the biggest needle mover with your acne? I have a suspicion, but just wondering.
I've always been kind of an extreme personality. And at that time I was like kind of an aspiring bodybuilder. And so I was doing all this crazy stuff, and doing extreme diets and taking all kinds of supplements and stuff like that. And taking huge amounts of protein and huge amounts of dairy, huge amounts of meat, that in order to try to build muscle, and overeating in general. And I think that in context with a young, teenager sort of hormonal state, probably combined with some nutrient imbalances, and it's probably like deficient in some nutrients and didn't have the proper balance of certain things, zinc, copper, vitamin A, which have a link to acne. I would suspect that, like, given the nature of my extreme diets and everything I was doing with that, I think that was probably a major cause of what I was experiencing. But I'm curious what your intuitive hunch is.
Well, that was it, is that, it was likely diet and nutrients are the top two. And that's the top two things I target, so remember, priming the body, we're doing that, is diet and nutrients. And, I've just recently treated a bodybuilder, and his inflammatory profile and his lipids were all over the show because he was carb loading and eating way too much. But yeah, if you can get the diet right, and that's where we always start. And there was an interesting documentary called The Gut Movie. You probably have heard of it. And I did a showing here, and they highlighted a producer out of Australia who ate the standard Australian diet. Ironically, it's called SAD, just like our standard American diet, which is SAD. And he flew to Namibia in Africa, and they did a stool sample before he flew. And then for 1 week in Africa, he ate with the local indigenous people what they ate. So it was all whole foods, obviously nothing processed. And they did a stool sample at the end of 1 week. And in 1 week, he reset his whole microbiome. So that's the testament. And I really think, just you really should balance that with how sick are you, like you had said. So most people who are coming to me are pretty sick. You're kind of the exception. And we're kind of working in a different capacity too. And so listen to the instinct, listen to the story. Where on the spectrum of illness do they lie? And then make your decision. I've had people get really, really sick from having a colonoscopy. So that wipes out the whole microbiome of your large intestine. And now I just found a company yesterday, at a conference, that makes probiotic suppositories. So if someone needs a colonoscopy, then you can support them. So, or coffee enemas, are utilized to detox from mycotoxin illness, or just in general as detox strategies. And so that's a way to support the microbiome, but with food first. So that's what I was going to say. I think it was probably food and nutrients.
Totally. Yeah. One other thing that I probably should mention in that context is I would eat the same things every day. So, and probably lack of diet variation. Like I probably developed some intolerance or allergy to some of these foods that I just consume, 2-3 times every single day for years. So probably also factored, but yeah, I definitely agree with your hunch on that one.
Yeah.
So one other question I have regarding mold mycotoxin testing, and this is something you and I encountered just a couple months ago when we got the results of my most recent test. The good news is I'm completely free of mycophenolic acid. What was off the charts, it was like 800 something on the initial test. And that was, I think, what was considered high was like above 35 or something like that. And I was 830 or something to that effect. This most recent test showed I'm at a 0 on mycophenolic acid. So that's processed. But I have what seems to me to be very low level toxicities. And I think ochratoxin and one other one, I forget which one. But there was also some disagreement between the two tests, the one from Real Time Labs and the Great Plains Labs mycotoxin, urinary mycotoxin test. What is your take on the sort of cross validation of those tests or the degree of validity? Does the disagreement there speak in any way to lack of validity of these tests, or is there an issue there?
I think that historically what we're seeing is Great Plains picks up ochratoxin better and all of its byproducts, so citrulline and mycophenolic. And then Real Time tends to pick up the gliotoxins, trichothecenes, et cetera, and aflatoxin. So glia, afla, and trichothecenes better. So it could have been that. Although I've had a person come up with negative recently on Real Times, everything was negative and then had positive on Great Plains. Or as you mobilize out of the body, you pull other things. So one or the other. And I think we should always be questioning. Always question, because it's going to change. And I've been doing functional medicine almost a decade and probably mycotoxin illness for the past 3-4 years now. And the protocols are vastly different. I keep adjusting it. And that's what I tell people, that, I'm treating you even when I'm not treating you, because I'm at some conference, I'm jotting down notes. If it's an emergency, I need to stop something or start something, I'm contacting them in between appointments. Typically it's not an emergency, and then we're going to change the protocol, the next time I see them. So always question. And I think the discrepancy that we've seen is that one tends to pick up one better than the others. And don't even get me started, is it doesn't correlate to what we're finding in our homes. I wish that would correlate so we can identify. And that's why I started the mold community, is I'm bringing together all the experts. I'm providing just foundation, because remember, if I can get someone 50 to 90% better with things that don't require any binders and make them functional, that's huge for someone's life. And I'm going to be interviewing experts. I'm interviewing one later today. We didn't even touch upon, but mast cell activation syndrome, that makes it very difficult to recover as well. And so that'll be a little later today. And it's just amazing, because I want answers too. There's a lot of confusion, and especially when it comes to the home and testing. So always question, and I'll be doing that. And I'm going to keep revising the protocols as things unfold, and, really tailoring it. It's very individualized when someone comes to see me.
Yeah. So good news for me, I'm back to 100% at this point. In, I would say, most of 2020, after I think several months long of that mold exposure, I had all these weird and unusual symptoms start to crop up. I would wake up every morning with a lot of stuffiness in my nose. My son did too. Both he and I became prone to getting respiratory infections. At the beginning of the year, towards the beginning, right as COVID was starting to hit, or actually just before it sort of was really being publicized, I got some kind of severe respiratory infection, probably the worst respiratory infection, not probably, the worst respiratory infection that I've ever had in my life. And my son got it too. And it very unusual, very atypical, and really, like, I was coughing so severely that all my neck muscles were like sore and in pain. And it's very rare for me to cough. And it lasted, what was most unusual, it lasted about 5 or 6 weeks. Instead of like a typical thing, which if I get a cold, it's, you have very mild symptoms for 3 or 4 days. And then, by 7 days into it, you're back in action. In this case, I was out of commission and couldn't really exercise for about 5 or 6 weeks. And then it was only after a month or two later, when COVID started getting more publicity, that I realized, hey, maybe I got COVID. I still don't know for sure if that was COVID or if it was some other type of thing, like maybe whooping cough or some other respiratory infection that was just really exacerbated because I was also poisoned with mold. But then for all of 2020, basically, I had some of those kinds of symptoms. I would say lower energy than I should have been. I had some, like, my immune system did not feel strong. I felt prone to infection. And probably the biggest symptom was a really decreased tolerance to exercise. So I could only do like a third or a fourth as much exercise as I normally would be able to before I would really feel my body kind of crash and get fatigued or get prone to like catching a cold or something like that. I would really feel the immune suppression from it. And I just couldn't tolerate and recover from a significant amount of exercise. I'm very happy to say that now, about a year later, a little more than a year later, I'm like doing tons of exercise now and feeling great and feeling 100%. So I frame all this context only to ask you the question, give some people some sense of how long it takes to recover from mycotoxin illness. I've heard some people say, hey, it takes years. Other people say, no, you can do it in a much shorter period of time. But obviously, I guess it depends on the severity of the case, but what's your sort of overarching take on how long it takes people to recover from mycotoxin poisoning?
You hit the nail on the head. It's typically 1 to 2 years once you're out of the environment. And I think that you're on that shorter end of the spectrum because you are healthier going into it, probably a shorter exposure. So, and that bodes well. you would not be recovered from mycotoxin illness and exercising at this level if you were still sick from it. So that really bodes well we use clinical indicators. So if our lab testing shows X and someone looks Y, you have to say, well, what's going on here? So I'm really happy to hear that. How's your son doing?
He's doing awesome. He's 100% as well.
So it's amazing and it's really bringing light. A lot of people don't even know it exists. Number one, number two, they have no idea the impact on their health. And the sooner you can treat it, the sooner then you can just move on with your life and enjoy it. Sounds like you're in a nicer environment these days with the animals in the background, and that's huge. So
yeah, absolutely. So is there any other guidance that you want to leave people with? We're coming to the last few minutes here. Do you want to leave people with just a couple thoughts on maybe emphasizing, which kind of person should seek out mycotoxin testing, and anything else that you can think of as far as what you want to leave people with?
So the type of person that really should seek this out is anyone who is far down the rabbit hole. So really sick, no one knows what's going on, or even mild to moderately sick that isn't responding. So anywhere in the spectrum, the worse off you are, the quicker you should be tested, like immediately. The ones that are mild, it really just depends if they respond to the usual measures. If you're eating a healthy diet and sleeping and you're still not better, you've worked with a practitioner, or if you've seen a practitioner and maybe they don't treat mold illness, then you really should be seeking out the answers to, is this mold, and being tested. And just know, key is priming the body, finding that person to work with, whether it's in a community study like we're doing or one-on-one. And, that's my goal. I want to break the barrier of, can we do this without having to see people one-on-one? It's a lot harder to see one patient at a time over the course of an hour or more versus handling 100 people that you educate, and then they can empower themselves to get better. And then just know that there are other things aside from mold. So if it's not mold, there are other red herrings you should be exploring. So Lyme and metals. I typically will do that a little later in the course. And we didn't touch upon, but you can also do environmental toxin testing. So we're all exposed, but you'd be surprised. Some of my healthiest living patients, so they eat organic, they do all the right things. And I've identified really high markers for things like phthalates. And now you have to go say, what is it? And water, you have to have a clean source of water. So, get the foundation right. And if you've been unwell to chronically unwell and it's not getting better with the usual steps, or if you're chronically unwell, no one knows, then get tested for mold and take action, get out of the environment, get treatment so that you can live the rest of your life.
Beautiful. Dr. Galbraith, thank you so much for coming on the show and doing this. To everybody listening, I just want to give, obviously, my personal endorsement. I mean, you just heard that I've specifically sought out Dr. Galbraith care for myself and for my son for our own mold poisoning. So that gives you pretty much the strongest sort of personal endorsement that I could possibly give someone. And I just mentioned that, we've done the most recent bout of testing, which showed that I've pretty much cleared the vast majority of this, and I'm now feeling great, and so is my son. I also want to mention that, as I said before, in the context of doing some of the more aggressive protocols, antifungals and stuff, I really appreciate how she listened to me and respected, kind of my view and my take on things. And in contrast to some doctors who are a bit overly assertive and need things done their way, and, it's sort of their way or the highway. She really respected me and listened to my take on things and worked with me to find a balance between what I wanted and the optimal protocol from her perspective. And I just really appreciate it. If you guys are struggling with unexplained symptoms and not getting anywhere, or you have a known mycotoxin exposure, I really encourage you to seek out her care. Also, I want to mention there's no affiliate links or anything. I don't make any money off of you seeking out her care. This is just my own personal, doctor who's been treating me for mycotoxin illness. And I wanted to give her a platform to help others who are struggling with this issue. So Dr. Galbraith, thank you again so much. And I look forward to the next conversation. The one last thing is, where can people reach out to you if they are interested in working with you?
Yeah. So the most cost-effective means is the newly launched Conquering Mold community at conqueringmold.com. one-to-one care, they would go to drrajka.com. I'm sure you can post that link. And then soon I'm launching, and by the time this is up, a community to kind of target fatigue in women, fatigue, hormonal imbalances, even the weight gain. And that community is being launched and named Radiantly She. So that'll be radiantlyshe.com. So.
And you have a Conquering Mold community as well, right?
Yep. So the Conquering Mold community is just conqueringmold.com. And it's pretty cost effective. You know, like I keep telling people, it's less than a cup of coffee a day. Get you better. Yeah.
Awesome. Thank you so much, my friend. Really appreciate it and look forward to the next conversation.
Yeah. Thank you, Ari.
Hey there, this is Ari again. Thank you so much for listening to this episode. I hope you enjoyed it. If you did, if you found it valuable, please share it with your friends, share it with your family, help me get the word out there. Also, if you're on YouTube, make sure to hit the subscribe button and hit that little bell to get notifications every time we release a new video or new episode of the podcast. And if you're listening to this, make sure to subscribe to this podcast on iTunes or on your favorite podcast app. Thanks so much for supporting my work at The Energy Blueprint. I hope you enjoyed this episode. I will see you in the next one.